Hello everyone, this is Annalie. Welcome to CNA Review. Today we're going to talk about the role and responsibilities of the support worker, Chapter 1 of the Canadian textbook for the support worker. So let's begin. A support worker is a general term used to describe a person who is designated to provide care and assistance to clients of any age. Any age can be someone who is an infant, a child, an adolescent, a middle-aged adult, or an older adult who have defined healthcare needs and who require help with their activities of daily living, whether they live in a facility or in the community. So in other words, a support worker will only provide care and assistance to clients who needs it and who were assessed by a healthcare professional like a nurse, a doctor, or a physical therapist that he or she rather needs help with the activities of daily living. Now, activities of daily living are those tasks or activities that a normal person will do on a day-to-day basis for self-care and in order to survive. An example of this is eating, drinking water, going to the shower, toileting, transferring self, changing clothes. These are examples of activities of daily living. And the support worker will provide care to people who are admitted in the facility, which is the hospital. In the hospital, there are other professionals also who work there for the client. And also in the community, it can be an assisted living, a group home, or a private home. Across Canada, there are different titles given to support worker. There are also the educational preparation, the job description, and the work setting differs from province to province. So if you will turn on your book on page 1137, which is the appendix, it is listed there the titles given to the support worker. In British Columbia, it's healthcare. The title is healthcare assistant. In Alberta and Manitoba, the title is healthcare aide. In Saskatchewan, the title is continuing care assistant, as well as in Nova Scotia, continuing care assistant. In Ontario, the title is personal support worker or developmental support worker. In Quebec, it's home health aide or home support worker. In New Brunswick, it's personal support worker. In Prince Edward Island, it's resident care worker. In Newfoundland and Labrador, it's home support worker or personal care attendant. In Yukon, it's healthcare assistant. In Northwest Territories, it's personal support worker. And in Nunavut, it's home support worker or community support worker. Role of the support worker. The role of the support worker is essentially or primarily to provide care and assistance to clients to accomplish the tasks of everyday living, otherwise known as activities of daily living. The assistance varies from each client. One client may require little help or minimal help. For instance, meal reminder or medication assistance, or meal reminder, medication assistance, plus compression stockings. Other clients may require more assistance or extensive help by feeding them through G-tube, changing their ostomy appliance, transferring them with transfer device, changing their incontinence product, and giving them bed bath. So the assistance does not only include personal care, but also support services. Support services are example of support services are um, um, assisting client with their prescription refill, or assisting client with booking their appointments, assisting client with arranging transportation, or making sure that the water supply is adequate before the shower, before the client will take shower, or the support worker will check the temperature of the water supply prior to assisting client to shower. There is also an opportunity for the support worker to make a difference in the lives of people and family members by way of ensuring that they are there, they are present, and uh, the client is not alone, by providing therapeutic companionship, ensuring that the client is not in pain and is comfortable, making sure if the client is not able to mobilize himself, is to be able to move the client every 2 hours from side to side to prevent injury, pressure injury, to make sure that the you advocate for the client, you speak for the client. Now, the ultimate goal of the support worker is to improve the quality of life of the client and family by offering client-centered care. So we will talk about client-centered care in the next chapter, and to support clients in safe, kind, and sensitive, caring, and understanding manner. So why is it important to provide safe support and care and assistance to the client? We want to make sure our service is safe so that we will not inflict any trauma, injury, or potential danger to the client. Otherwise, we will be dealing with serious legal consequences in the future. So an example is providing safe care is making sure that the support worker has the education and training to provide care and assistance. They are trained and skills to handle transfer devices or other medical devices that is needed for the client. They know the care plan very well. They make sure that they identify the right person. They make sure that they check the medication administration assistance when they assist residents or clients with medication, and they document each of the care that they provided to the client. Being kind and sensitive and caring means that we have to speak to the client in the language that he understands. We use appropriate words when communicating to the client. We listen to them in a non-judgmental way. We make sure that we allow the client to verbalize their fears and anxiety, and we do not perform procedures that is abrupt. Our action should not be abrupt when providing care. We have to provide dignity and respect to the client. There are times that the client will demonstrate fear, will demonstrate anger and frustrations towards the support worker. So the best way to do that is not to take it personally, but to look beyond the behavior of the client. Try to identify what causes the client to behave that way. Because remember, the focus of our care is the client and not the support worker, or not the co-worker of the support worker. Various work setting for the support worker. One is hospitals. In the hospital, there are different healthcare professionals who work for the client in the hospital, and that includes the support worker. The hospital is a facility where clients or patients are brought in because they need immediate intervention. Another work setting for the support worker is mental health facility. Next is facility-based settings, for example, long-term care and rehabilitation center. This type of setting is they require longer help and assistance, maybe 6 months, 1 year or longer, or even until the end of their life. Next is home support, home care. We have assisted living, group homes, and private homes. The support worker can also work in the palliative and hospice center. In this center, they provide comfort and care to people who diagnosed with terminal illness, and the medical practitioner will declare that there's no more cure for that person, and that the support worker will be there to help the person until the end of their life. So types of clients that the support worker provide care are not only those who are in the hospitals, but also those with cognitive issues. When we say cognitive issues, these are people who has challenges in memory or remembering things or learning new things. For example, dementia. Next is mental health challenges. These people does not need, or this client does not need to be in the mental health facility. They're discharged to home, and they need the support worker to help them out in their homes, to help them with the skills that they need, to help them perform the activities of daily living. Next is developmental disabilities. These are clients who were born with physical disabilities or challenges, and learning and mental challenges. Now, the support worker can also assist clients by providing them social support, arranging arranging recreation activities, um, setting up meeting with their friends, because remember, recreation reduces the risk of depression, stress, and isolation. The client is happier if he is engaged with his families and friends, if he is engaged in other activities. Social integration. The support worker can help clients to integrate socially by assisting them with the skills, for instance, cooking, going to shopping, or taking their medications, so that they can live independently in the community in the future. Now, safety is still our number one priority. We want to make sure that the client is always safe, making sure that in all setting, whether it is in the hospital, at home, or even in the palliative and hospice, we always want to make sure that we provide safe care to the client. Responsibilities of the support worker. One is personal care. Two is support for nurses and other healthcare providers. Three is family support. Four is social support. Five, housekeeping and home management. Six rather, documenting and reporting any basic assessments, observations, and care provided in the client's record and chart. So we will discuss this later.